Oftentimes when patients come into the office, the first thing they say is, Miguel, what do you see with my face? What can we do? And the thing to remember is when the brain is analyzing the face, the way that it recognizes the face is first is the eyes, then the lips, periphery, followed by the nose. So what's most important is the eyes, right? So that's the first thing we see when we're tired, when we're happy. That's how we're focusing our face. So we really need to make sure that we kind of pay attention to that from a surgical standpoint. So what does that mean? We can do a couple things. We can do blepharoplasty, which is the surgery where we remove the excess skin above the eyes. We can do a lower blepharoplasty where we remove the bags under the eyes. We can pick up the brows, which basically frames the eyes and helps them look a little bit more natural. And so there's always a combination of those procedures that are needed. Now, it's very important to make sure that that procedure is tailored for the person, because there are some patients that come in and even though their brows are a little heavy, their brows have always been heavy. So if you were to do a brow lift, guess what? They're gonna look like a completely different person, and that's never the goal. So in those cases, we need to focus on the skin itself. Or maybe they need a little bit of volume with some fat grafting in the upper eye. Or maybe they just need the lower eyes taken care of. So when assessing what a patient needs in the aging process, it's very important to always pay attention to the upper third of the face, particularly the eyes, and come up with a very bespoke treatment plan such that it caters specifically to them and how they looked before, how they're aging, and what their goal is at the end.